Bonjour à tous.
Good morning. Now, what I'm going to do is just give you an overview of what we have been doing with Samir and Pierre. So what we're going to try to start with is to show what we've done since the Observatory of e-health has been launched and what we've done in partnership with the Pierre Fabre Foundation. And the other point I would like to focus on is what we've done in all of these countries, which are vulnerable countries, because we've been screening all these projects. We wanted to see what the needs were in the French-speaking countries who are considered as being very fragile. And the last point I will cover are the different examples that we have in English-speaking countries, in Africa and in Asia, and how inspiring this has been, taking into account business and non-business aspects. Now, if we get back to the e-health in southern countries, what is the basic rationale? Well, I think that what is at stake is very important because when you speak of digital, we're not speaking here of gadgets. We're really speaking of something which is serious. You can see here that the mortality rate of mothers for 100,000 persons, we have 480 mothers out of 100,000 birth. So that means that you have 80% more possibilities of dying in Africa when you're a woman. So you're more vulnerable when you're in Africa, much more vulnerable. Now, the key question is how can e-health help us to solve this issue, which is dramatic? It's not only with e-health that we're going to solve this because we have other aspects coming into play, but what we can highlight in this case, and this goes without saying, that we also have financial priorities. For instance, GDP, and the percentage of GDP which is dedicated to health. We all hope that the digital technologies will be real leverages. We still don't have this in many of these countries. And some of the aspects I'm covering now, which I find very interesting, is transparency, because I think that this is paramount in these countries. Like Samir said before, we don't have the appropriate governance. There's a lot of corruption. The state doesn't play any role. So if you die because you didn't receive the care you need, this is really tremendous. And we have to do something about this. This is why today, with our digital technologies, we have mobile phones and specific apps which are provided to our population. That means that people know more about the health care. There's more transparency concerning the caregivers and the doctors. That means that the individuals themselves can assess the quality of the health care they're provided with. Now, the other aspect I would like to underline is that in all these countries and southern countries, we don't have real access to data which can be considered as being updated and reliable. And I think that digital, there is a very good tool, because in that case, we are in contact with the end user, we're in contact with the end user, and that means that we can communicate, we can disseminate in real time all these data and be more efficient when it comes to taking a decision. Now, the other point I wanted to mention concerns the observatory in more fragile countries and vulnerable countries. So what have we done concerning e-health in these countries? Well, Beatrice and other people in charge of the Pierre Fabre Foundation have been going through this. They have assessed some of the results we've got. And Mr. Godefroy, our former minister, has clearly said that the main initiative was to help these fragile countries. And this is why we've really centered our assessment there. Burkina Faso, Mali, we don't have Zambia or South Africa, because we really wanted to center this observation on fragile countries, and I'll tell you why. What do I mean by Africa? Well, it's very difficult to generalize. Africa is a unique and homogeneous continent. No, there are many idiosyncrasies which vary from one country to another. We have an overall population which is 8 times the one we have in French-speaking countries, but the GDP of all the English-speaking countries is 1.55 more than what we have in French-speaking African countries. So we have very strong English-speaking African countries countries, but on one side, but we have poor French-speaking African countries. If we see what's going on also in these countries, we see that 5 out of 6 countries are in French-speaking areas. For instance, Burkina Faso and other countries like Mali, Chad, or the Democratic Republic of Congo. So when we speak of observation, as Pierre said, with CATEL, we have centered this screening on these countries, so Mali, Senegal, which have their own idiosyncrasies, as I said, and these are fragile countries. They're more vulnerable. This is why we consider that we have to prioritize and dedicate all our efforts to these countries to start with. Now, another point I would like to highlight is that digital technologies are more developed in the English-speaking African countries. One of the comments which were made at the very start of this meeting is that we have more business in the English-speaking countries. Now, why do we want to focus all our developments today in French-speaking African countries? Because they're more fragile. For instance, if we look at what's going on with mobile phones, it all started in Kenya. In Kenya, at least a third of the GDP will be invested in mobile phones. But it's not the case in French-speaking countries, even though we have made a huge leap thanks to mobile phones. And this is something which is also in line with business, because this is one of the drivers for telecommunications in French-speaking African countries. And this was after Kenya started, because Kenya, as I said before, was a pioneer country. But our minister, Mr. Godefroy, told us that it started in the northern countries. But we don't always see this kind of initiatives in French-speaking African countries, even though it's a huge business. It could become a huge business. Now, apart from the health issues, when we speak of African vulnerable countries, we see that life expectancy is 55, 66 years, according to the countries. Between Mali and Kenya, we have a gap of 8 years in terms of life expectancy. And this is something that has nothing to do with urban development and so on. And it's not going to be solved through urban development. Therefore, as I said before, we have really dedicated most of our efforts to these fragile countries, and this is where we're going to go into numbers which only concern these fragile countries, countries which are mostly French-speaking countries. These are the figures we have thanks to our observation process. And Pierre has shown you all the figures or all the numbers that we've got through CATEL. And we see here that 80% of the data comes from Africa, because as we said, we have Africa, Asia, and India. But we really wanted to dedicate our efforts to fragile countries in Africa. For instance, the mortality rate of mothers, you see here the difference between Asia and Africa for 100,000 persons. For instance, see how dramatic the rate is in the French-speaking African countries. Now, if we look into the graph, you see here that 80% of the initiatives which have been observed with e-health and the Pierre Fabre Foundation take place in Africa. 22% are outside Africa, and 80% are in French-speaking areas. Now, another highlight, if we look into these numbers, we see here that in Africa, 2/3 of the initiatives which have been developed have really been developed in Western Africa. And we know that the dynamic area in Africa is Western Africa. It's the Austral area. And if we look at Northern Africa, we're speaking of the Maghreb countries. Now, the countries of this area, if we look at all the populations of these countries, that means 80 million persons, that is to say, the overall population of Egypt on its own. So we decided, as I said before, to look into these vulnerable countries, because the Northern African countries, the ones you see here, are the ones where we have a low life expectancy. Between Mali and Morocco, well, we see here that people in Mali don't live as long as in Morocco. Very last point now I wanted to cover. It goes without saying that we have really dedicated all our efforts to more fragile countries. What can we do in Africa and outside Africa so as to foster the development of a new methodology and of new healthcare systems? How can we do this through our observatory and e-health? Well, maybe there is here a hint of what can be done. And also with our partners, with the telecommunication sector, because telecommunications are very active, very dynamic in Africa. In Nigeria, for instance, they're the first oil producers, and they have more employment in Nigeria thanks to telecommunications. The employment there has been fostered by telecommunication and not by the oil industry. Now, if we look into what's going on in telecommunication in the GSMA, which is a consortium, a world consortium of mobile operators, what they're really interested in is the mobile health. That is to say, part of e-health will be on the mobile phone. This is one of the apps that we're going to develop in the future, and they really have been very interested by some initiatives in Africa. But as I said before, most of these initiatives started in the English-speaking African countries. And then you also have a tracker, a health tracker, which has been developed in these countries. So a first step in this development for our observatory and for our e-health would be to start having more partnerships with all these operators and also people like GSMA. These are the partners we need because they really are very present in these countries, and they can also develop all these projects. In a South African company, I would also like to mention, which covers other countries, 15 countries, African countries, Vodafone and Orange, and these are the other operators which can also come into play. Now, what I would also like to highlight is the other approach we could have. How can we develop partnerships with giants in digital? We've been speaking of Silicon Valley. What we all know is that in Silicon Valley and in the United States, the richest people are getting organized so as to help other countries on the planet, especially through digital initiatives. And this comes from the digital area. We know this. In June in 2016, Mark Zuckerberg, who is the founder of Facebook, decided with his wife, and they developed a Zuckerberg Foundation, would give $24 million for one project in Nigeria. So $24 million only for one project. Another example is the Google Foundation. Google.org decided that they would dedicate 1% of their overall capital and 1% of their revenues to development and research. And having said this, we see that in March, they gave more than $1 million plus engineering expertise to other African countries. And the Bill Gates Foundation in January 2015 has devoted more than $700 million for one project so as to fight Ebola, the Ebola virus. So we can imagine other bridges between our foundation, the Pierre Fabre Foundation, and all these countries and e-health, because I think that this is legitimate. This will be developed in the future. I think that the real vocation, the real mission of the foundation and the observatory is to help these vulnerable countries, especially if we look into what's going on now. What about the landscape? We hear that Vodafone and Orange are all concerned about this. Now, there are other gamuts of initiatives which have been implemented by states, because even though the countries are vulnerable, we have sometimes public authorities and governments who are become increasingly involved in e-health. This is the case in India. This is the initiatives which was implemented by the federal state of India. In 2016, they've launched a federal program which will be implemented in rural areas. They want to involve more than 3 million women with the Grameen Foundation. So we have two major programs, a federal program in India and another program for rural areas, because in India today we're very much concerned about what is going on. India is an emerging country, a very potent country. It's different from Africa, but there are rural areas which are really underdeveloped, and we have more than 1 billion persons today in India, so most of the population is very vulnerable, and we have 600,000 villages in India. This is why the mobile phone coverage program is targeting these populations, and India is very much interested in having partnerships with French-speaking African countries. And in India, we also see that these different states are also developing new initiatives that you can see here in Andhra Pradesh, for instance.
Voilà, je vous espère ne pas avoir plus trop de temps. Je vous remercie.